Okay, so I'm just gonna maybe wait a few more minutes for people to enter. The recording is started. Okay, so hello everybody. I'm really happy that you're here. This webinar is an initiative of the Quebec Network of Junior Pain Investigator. Today, Dr. Allen Steverman is gonna give a presentation on mindfulness from application is stress reduction to intervention in chronic pain management. Dr. Steverman is an attending physician at the pain clinic of the Hospital Center of Montreal University. He is also an assistant professor in the Department of Family Medicine and Emergency Medicine and he works in collaboration with the NeuroNova Center of the Toronto University. Before I let Dr. Steverman speak, I just want to make some precisions. So first, I really apologize for the people that won't be attending the presentation right now, but we will record this webinar and share it with all the people that registered in the first place. Second, if you have any question during the presentation, please write it in the chat. And at the end of the presentation, we will have time to read some of the questions and answer them. You can write it in French or in English. And finally, in a few days, we will receive a quick survey to allow you to give us your opinion on this webinar and help us to improve our next webinar. Thank you very much. And Dr. Steverman, you can start.
Okay, great. Thank you very much, Joanna. And it's a real pleasure to be here with all of you, unfortunately in a virtual world and not in a live world, but this is the times that we're living in. So I'm just gonna share my screen. Okay, someone will let me know if you can't see that, please. As Joanna mentioned, I'm a physician with a focused practice in chronic pain management, and I work primarily at the pain clinic at the Clinique Anti-Douleur of the CHUM, and as well as a mind-based clinic. And today I've been invited and asked to speak about mindfulness, applications in stress management, chronic pain management. So just to give you a sort of a brief overview, my clinical work is in chronic pain management. So at the pain clinic, I do what you would probably imagine a chronic pain physician does, is I see patients, I make diagnoses, I confirm diagnoses, I set up treatment plans, which include medication, injections, physiotherapy, psychotherapy, and all of the multidisciplinary approach. And one of the pieces that I've been particularly interested in and implementing both at the CHUM and at the Mindspace is a mindfulness program specific for chronic pain management. So I'll be able to speak to you a bit about that today. As was mentioned as well, I'll be giving the presentation in English, but at the end, the question period will be either English and French. Et vous pouvez être à l'aise de poser vos questions dans la langue que vous préférez, and I'll be able to answer questions either in English or in French. So the plan of today's presentation is, if we're going to be talking about mindfulness, is perhaps to have a definition. So we'll talk about what is mindfulness, what is meditation, and also what is not meditation and sort of some of the misconceptions. what are some of the benefits that mindfulness have been shown to have and that might be of interest to you, and what's the evidence. So I realize that I'm speaking to a group largely of researchers, so I think you might be interested in hearing some of the evidence. And then we'll go more specifically into why mindfulness for chronic pain, why think about using it, and where does it have a role in chronic pain management? Again, reviewing some of the evidence. And then I'll specifically speak to you about a program, the Mindfulness-Based Chronic Pain Management Program, which is one that I work with specifically around chronic pain. So let's start with mindfulness. So a term that many of you have probably heard about. I suspect many of you know a little bit about it, some of you probably more. A term that's perhaps overused and not always used in the most appropriate way. So I'll just start by giving you the most common, I would say, definition, sort of the Jon Kabat-Zinn definition, and I'll speak in a few minutes about who Jon Kabat-Zinn is. So mindfulness is defined as the awareness that arises through paying attention on purpose in the present moment, non-judgmentally. So a lot of words in there, but it gives you the elements of what we think of as mindfulness. Another way of putting it is mindfulness is about maintaining a moment-to-moment awareness of our thoughts, feelings, bodily sensations, and surrounding environment without judging them. So it's about being aware of what's going on inside of us and outside of us without judgment. Now, a definition that's not the traditional definition, but one that I think is sometimes helpful to wrap our head around some of these concepts, comes from Dan Harris. So those of you who may or may not know, Dan Harris is a American TV correspondent, not someone who we would have thought would have been interested in mindfulness, but for various reasons got very interested in mindfulness. And Dan Harris's definition is mindfulness is the ability to see what's happening in your head at any given moment so you don't get carried away by it. So not the traditional definition, but I think a definition that helps for some people to get a better understanding of what we're talking about. So when we talk about mindfulness, we also talk about meditation. So let's look at what meditation is. Meditation is about setting a specific amount of time in which we practice focused awareness and attention on a particular aspect of our experience. And I'll take a few minutes and break it down in a second of what that means. What we do know about meditation is that practicing daily allows the mind to practice entering a state of lowered arousal and to practice being present without evaluating what is noticed. And we also know that there's the sympathetic activity of the nervous system may decrease and parasympathetic activity may increase. Now, meditation. What is meditation? Well, it may not be what you think it is. And one of the misconceptions, and I think this is probably, hopefully, one of the take-home messages that you might be able to take from today's presentation, is that meditation is not relaxation. Now, relaxation is valuable, is important in many domains, including in stress management, anxiety management, and in particular in pain management as well. Having said that, it's very different from meditation. And it's different in many ways, but primarily when we're talking about meditation, we're really talking about focusing the mind. So we'll in a second get into what that means, but it's really an exercise or a practice where we're bringing our mind to focus and concentrate on something. Relaxation, on the other hand, is really allowing our mind to wander, right? So if you've ever done a relaxation or listened to a recorded relaxation, often it'll be sounds of the ocean or sounds of the birds, or when we're not really paying attention to anything specifically. And eventually with relaxation, when we're ultimately relaxed, we could eventually fall asleep. In meditation, we talk about focusing our mind, and we sometimes actually use the expression falling awake to really make the distinction between what meditation is and what relaxation is. Another misconception is that meditation is emptying the mind. And very much related to that is that it's about not thinking about anything. And I think that's one of the, again, misconceptions that probably accounts for people sometimes trying meditation, not really understanding that these notions, and then sort of trying it once or twice and giving up on it very quickly, either by concluding that I can't do this because I've got thoughts in my mind and I just can't stop thinking, or it does nothing for me. Now, when we understand that it's not about emptying the mind and it's not about suppressing thoughts, then it really opens up a very different impression and a very different understanding of what meditation is. So what I'll ask you to do now, actually, for a second is perhaps we'll take about 30 seconds. So wherever you are, whether you're sitting in a chair or standing up or walking or wherever you are, what I'd like you to do for the next 30 seconds, and I'll stop talking in a second, is I want you for the next 30 seconds to really think about nothing. So I want you to really take 30 seconds, nothing in particular, and I'd like you to think about nothing. Okay? So when you're ready, I'll give you 30 seconds starting now. Okay, and you can stop now. Of course, we're not live, so it's hard for me to get feedback from you, and perhaps later on I'll be able to. But if I asked for a show of hands, how many of you for 30 seconds were thinking about absolutely nothing and had a completely empty mind? I suspect the majority of you would tell me that that wasn't possible. And that's exactly true, because that's what our mind does. Our mind is continuously analyzing, thinking, going to the past, going to the future. And emptying our mind and suppressing our thoughts is actually not possible, A, and to be honest, is not at all what we're looking for in meditation. So we'll come back to that in a few minutes. So again, with meditation, it's a practice of bringing focused attention on a particular aspect of our experience. And it can be focusing on our breath, it can be focusing on sounds, it can be focusing on sensations in the body, but it's just really a exercise of bringing attention to something with intention. And then repeatedly noticing thinking. So while we're meditating, we're inevitably at some point going to realize, wait a second, my attention has gone elsewhere and I'm thinking about something. And when we recognize that we're thinking, we recognize it, that's a moment of mindfulness, and then we return non-judgmentally, gently, to a bare and focused awareness back to the present and back to whatever it is that we had said our intention to focus on. So the mind will wander during meditation and we bring it back. And finally, one, I think, important point about meditation to understand, and in particular when we talk about chronic pain management, which we will later, is that meditation is not about positive thinking. So it's not about wanting negative things and everything to be turned rosy and positive. It's really about being present with the way things are in the present moment. And sometimes in the present moment, things are positive. Sometimes they're negative. Sometimes they're neutral. And it's really about developing and cultivating the ability to be present with things regardless of how they are in that moment. So I've talked about mindfulness and I've talked to you about meditation. So let's look at the two and how are they related and how are they interrelated and what does one term mean and what does one have to do with the other? So again, back to mindfulness, it's moment-to-moment, non-judgmental awareness, being fully present with what is happening right now. So that's really not about meditation. It's really about mindfulness in any moment in our lives. No matter what we're doing at any moment in our lives, we can be aware of what's happening right now in this moment. And again, which includes what's going on inside of us, our thoughts, our feelings, our sensations, and awareness of what's going on outside of us. Meditation is the tool that we use to cultivate mindfulness. So I'll give you an analogy, which is not perfect, but it sort of gives you a bit of a framework of how we think about meditation and mindfulness. Imagine that you are a high-level tennis player, and in order to become better and stronger at your tennis game, you need to get stronger. And the way to get strong is you go to the gym 3-4 times a week to lift weights. Now, the 3 to 4 times a week in the gym to lift weights, the goal is not to become a weightlifter. The goal is to take the skill that you develop in the gym and then have those skills available to you to improve your tennis game. That's how you can sort of think about meditation and mindfulness. The meditation part is going to the gym, but the benefits of meditation have actually very little to do with what's going on or what you're feeling during the meditation or even right after. the reason we do the meditation is so that we can develop a tool, just like we get stronger in the gym, so that we can then take that ability and apply it in our day-to-day moments. And our day-to-day moments are the moments of mindfulness. So the formal practice is meditation. And we know that in order to increase our likelihood of having mindful moments in our day-to-day life, regular meditation practice, if possible every day, is important. But ultimately, what we're working towards is really the informal practice, which is mindfulness in everyday moments. And when we are more present in our everyday moments, we're A, likely to be more present, and B, likely to be less reactive in our daily lives. And we'll speak about that in more detail in a minute. Okay, so what I'd invite you all to do now is we'll take about 3 minutes, and I'd like to guide you through a brief meditation practice. So for those of you who have done this before, it might seem very familiar. Some of you, it might be relatively new, but really what I'm going to do is I'm going to guide you. So what I'd first suggest that you do is just finding perhaps a comfortable position, maybe if you're sitting in your chair, if you're standing up, or if you're lying down, and just really settling into a comfortable position. If you're sitting in a chair, you may want to have your feet planted on the ground with your back, perhaps straight, but not rigid, and really finding a position that you feel is most comfortable for you right now. Your hands, if they're in front of you, you can have them perhaps resting on your knees or just sitting on your lap. And what I will do in the next 3 minutes is really guide you through a meditation, which means that I'm going to invite you to bring your attention to focus on something. And the something that I'm going to suggest initially will be either the breath, and I'll give a couple alternatives that might be useful for you other than the breath. So we'll start now. So once you have found your comfortable position, the option to either close your eyes or to keep them open. What I do suggest, if you do keep them open, is perhaps to take up what we call a soft gaze, which means perhaps looking a few feet in front of you, perhaps at the ground, or staring at something that's not particularly visual, perhaps avoiding staring into the screen. Or the alternative would be to close your eyes. And in the first few moments, the invitation would be to bring your attention to focus on your breath. An alternative to the breath, if that doesn't seem to be a focus that works for you right now, would be to maybe bring your attention to focus on the sensation in the thumb of your hand, or maybe the sensation at the top of your head. And you can use those points of attention every time I mention the breath during this meditation. So with your attention on the breath, the idea is not to modify your breath in any way. Just bringing attention perhaps at the level of the nostrils or the mouth, the chest or the abdomen, wherever it feels best for you in this moment to notice the breath and the sensation of the breath. So not modifying the breath in any way, just allowing our attention to the breath to bring us into the present moment. And then perhaps checking in to see if your mind has wandered away. And if it has, without judging, just gently bring your mind back to focus on the breath. Breathing in and breathing out. And now perhaps shifting our attention and bringing your attention to focus on the sensations in your feet. So maybe your feet are on the ground, or maybe they're up in the air. And just noticing any sensation that might be present in the feet. Perhaps aware of the sensations of the surfaces that are supporting the feet. And then when you're ready, shifting back our attention to the breath and to the sensation of the breath. And then perhaps noticing if the mind has a tendency to wander, as it often does, to thoughts or feelings. And if it has, just gently bring it back to focus on the breath. And as we near the end of this meditation, perhaps gently opening the eyes if they've been closed. And coming back to the room and to the present moment and to this presentation. Okay, so that was a brief guided meditation. And what I'd be curious to hear about perhaps at the end of the talk and when we have a chance to get your feedback is maybe you'll be able to comment on how that may have seemed different from the previous exercise of a few minutes ago when I invited you to think about nothing. And again, the idea about meditation is about practicing this ability to bring our attention back and to bring it back to focus on whatever we were having the intention to focus on. But much largely, the idea is that we then have this skill that we can bring into our daily lives, which are the moments of mindfulness. So we can have moments of mindfulness in activities that are otherwise very sort of mundane or routine. And you have an example here of what taking a shower mindfully could look like. And you have here an example of what an unmindful shower could look like. So the idea here being is that if we can try to have more mindful moments when we're doing activities that are relatively routine, can we also then take this ability and bring it into moments that are more challenging, moments that are more stressful, and moments where being able to bring ourselves back to the present moment has very high important value. So that's sort of the basics of what mindfulness and meditation are. Now, why mindfulness? Why is this of any interest, and why can this be of interest? So earlier studies, this is by Richie Davidson, who's a neuroscientist who's done a lot of work in mindfulness. So this is almost 20 years ago, started looking at whether mindfulness had an impact on improving our immune function, whether it had an impact on how we respond to stressful events, and specifically how our frontal lobes respond to stressful events. There's been research looking at density of gray matter, and this is one of the earlier studies looking and identifying that there was an increase in the density of the hippocampus and other areas of the brain as well. Research suggesting increased telomerase activity. So again, important or interesting observations when we look at how mindfulness may have an impact on immunity. And another research here indicating another aspect of downregulating pro-inflammatory gene expression. So again, perhaps indicating that there's a role in inflammatory and immune responses. Now, you might be thinking, look, this is perhaps interesting, but in our day-to-day lives, what does this mean? What impacts can mindfulness actually have on my day-to-day life? So this has been looked at in different populations, and this is a research article or an observation that I'll bring to physicians when I'm speaking about mindfulness, and where there's some indication that mindfulness can help reduce MD's risk of burnout, depression, anxiety, and stress. And now, since I was speaking today, and I knew that the majority or many of you here are university students, I wondered, is there anything specifically that's looked at the effects of mindfulness in university students, and perhaps specifically with regards to resilience? And you've probably been hearing a lot about resilience in general, and particularly during COVID and the pandemic, where resilience has been tested. And there has indeed been a study relatively recently in 2018 in the Lancet Public Health, and you've got the reference here, that was looking at whether a mindfulness-based intervention can increase resilience in university students, with some very interesting positive results. So again, mindfulness is about taking a step back. It's about finding and helping us become less overwhelmed by difficult emotions. And it allows us to respond rather than react. So when we're more likely to be in the present moment, we're more likely to see things clearly, which allows us to respond. I've already alluded to the fact that there might be a role in reducing stress and anxiety. We also know mindfulness can help with focus and concentration. And there's clinical applications in depression and relapse prevention, as well as in chronic pain. So many of you may have heard about mindfulness-based stress reduction, which is probably the best known mindfulness program. So started by Jon Kabat-Zinn in the late 70s, and Jon Kabat-Zinn brought meditation into mainstream medicine. So of course, mindfulness and meditation are not new. They've existed for hundreds of years, but they really became much more known thanks in large part to Jon Kabat-Zinn, who really tried to introduce mindfulness in medical contexts. So he originally introduced it at the University of Massachusetts Medical Center for a variety of medical conditions. It was a mindfulness-based stress reduction. It's an 8-week program, and it was like that back in the late 70s, and it still is very much similarly an 8-week program, and since then has really exploded, and there's hundreds of programs available worldwide. There's one program now that's an offshoot of MBSR, which is mindfulness-based stress reduction, which is called mindfulness-based cognitive therapy, which combines MBSR and concepts in CBT. So a program, as you can imagine, which is meant for depression relapse prevention. and a program of mindfulness-based chronic pain management for chronic pain, which I'll speak to a little bit later in my presentation. So we've talked about mindfulness in general and how it might apply in our personal lives and in helping us deal with anxiety and stress and resilience. Now, I'd like to spend a few minutes now to speak about mindfulness for chronic pain specifically. So why mindfulness for chronic pain? Why do we think that this might be an avenue that might help patients with chronic pain? So patients with chronic pain are often given the message that you will have to live with this pain. But how do we live with the pain? And that's where a lot of the approaches that we have in chronic pain management don't necessarily address this question of how to live with the pain. What we can start looking at with mindfulness is that we can learn to uncouple the somatic sensations of pain from the thoughts and the emotions that surround the pain. We can learn to manage pain by better understanding the personal relationship to it, and really with the idea that we can start collaborating with the pain rather than fighting it. And I'll speak to this a little bit further. And with mindfulness, it's really an invitation to turn towards the pain, to tune in to the sensations. Now, with mindfulness, does the pain completely disappear? Well, what happens often is that the unpleasant sensation may still be there, but the knowing of unpleasant sensation is actually liberated from the suffering. So the goal with mindfulness is not to change the content of one's experience, but rather altering the way in which it's experienced. And a term that Jon Kabat-Zinn uses is about befriending the way things are. So what this might look like is, do I want it? So do I want to have pain? No. But is it eroding the quality of my life? Not like before. And this is what we really observe with patients and participants who have gone through mindfulness training. They start to have this shift in their experience of the pain. So in order to further understand how this might occur, I think it's important to go back to sort of the basic ideas of the mind-body connection. So as many of you who are here on this call today will very well know, pain is really an experience. And in particular, when pain becomes chronic, it's no longer a sensation, but it becomes a condition and an experience in and of itself. We also recognize that the suffering caused by chronic pain comes from much more than the physical sensation, but it comes from the combination of the pain sensation and what it means to the sufferer and how it is interpreted. We also know that physical pain and mental pain are often, I would venture to say almost always inseparable, and that the experience of pain then therefore always has both a physical and a psycho-emotional component. Another quote from Jon Kabat-Zinn, which I think really underscores what we're talking about when we're talking about chronic pain, is that pain is not just a body problem, but it's really a whole systems problem. And this will perhaps underlie and explain how we think meditation can help, is that chronic pain really has the what we call a mind-body connection wind-up. Now, one thing that I think is very important to underline is, yes, the mind plays an important role in physical illness, and that's true whether we're talking about chronic pain, whether we're talking about hypertension, whether we're talking about depression, whether we're talking about diabetes. So the mind will always have an important role in chronic physical conditions. But this is certainly not to say that pain is all in the head. And for those of you who have worked in the areas of chronic pain and chronic pain management, this is unfortunately a message that is, first of all, wrong. Second of all, a message that is sometimes shared with chronic pain sufferers. And not only is it wrong, but it certainly doesn't help the condition and makes things managed a lot worse. So I certainly would not want anyone to leave today's talk and think that I'm implying that pain is all in the head. Certainly not. The pain is absolutely real. At the same time, recognizing the importance of our mind and our brain in pain management and how we can use that knowledge becomes absolutely important and essential, and underscores how mindfulness can be of value. And when we talk about mindfulness for chronic pain, I've talked about that mindfulness is about bringing attention and awareness. So one of the questions that you may be having, and certainly that patients will have, is, I don't understand. Are you saying that you want me to bring attention and awareness to my pain? That's exactly the opposite of what I've been trying to do for years. Now, we do know that when we bring awareness, so internal or interoceptive awareness of what's going on in the body, perhaps through meditation, that there can be an initial increase in pain, but over time, this is actually reduced. We also know that when we pay attention, and certainly when we do it in a way that's not through mindfulness and through meditation, the usual reflex is to take our consciousness away from the pain. It's an absolutely normal stress response. We try to get distracted and think about anything other than the pain. But what we do know is that with mindfulness and meditation training, we can develop the ability to bring our attention to where the pain is, letting it go, so letting our attention go there and stay there, which actually seems to play a role in the healing process. Now, this is done in a very sort of methodical and stepwise process. And even very importantly, when we go there, so when we bring our attention there, we always go there with compassion. So as we arrive in a second to looking at the evidence around how we think meditation is helping in chronic pain management, I think it's important that we go back to the question of why do some people develop chronic or persistent pain? And this is, of course, could be the subject of a 1 hour talk or a 2-day or a whole week conference. And I suspect many of you on this call in some way or other are working on different aspects of this in your research. But what we do know is that two people with very similar accidents or very similar surgeries will not necessarily develop chronic pain. So we understand that one person may be pain-free after a few weeks, and others will go on to develop chronic or persistent pain. We also know that, this is an example, what you have here is an image of a MRI where you see a disc that's impinging on a spinal cord, but we do also know that you can have two people who have the exact same CT scan or MRI report, and there's no way for any radiologist or anyone looking at this image to interpret whether someone is going to have no pain, a little bit of pain, or a lot of pain. So there are obviously many other factors that come into play when we talk about chronic pain. The question then becomes, why does the body break down? So why do some people go from acute pain and then develop a chronic pain condition? Why is there still inflammation, irritation, neuropathy months and years after an injury? Our understanding in chronic pain has evolved, and we understand more and more that there's a transition from an acute condition to a chronic condition via what we know as central sensitization, right? So there's a brain habit that is formed, and our nervous system gets stuck in a state of heightened pain experience reactivity. And this notion, this concept helps us understand how we think meditation and mindfulness is probably helping chronic pain sufferers. So what's the evidence? Is there any evidence? Thankfully, there's an area that's really been exploding in the last few years, what's called contemplative neuroscience. So a lot of the research that's been looking at what's going on in the brains of meditators. And we've had the advantage of using functional MRI and EEG to really study the brains of meditators and furthermore, people with actually very little experience who are just beginning to meditate. And I've really sort of summarized the highlights here, but this research really gives us the overall picture of what we think is going on. So there really seems to be two areas that seem to be important in pain management when it comes to meditation. On the one hand, we know that meditators have an increased activity in the primary pain processing regions of the brain. So many of you will be very familiar and even more so than I am with these areas, the anterior cingulate cortex, the thalamus, the insula. So the areas of the brain that are really involved in processing pain. And what we do know is that when we have increased activity, that these areas of the brain, and in particular the anterior cingulate cortex, can actually go and modulate and down-regulate pain. So that's one of the aspects on how we think pain is being influenced by meditation. At the same time, there seems to be a reduction in activity in certain areas of the brain that are more involved in executive, evaluative, and emotional areas of the brain. So the prefrontal cortex, the amygdala, the hippocampus, the medial cingulate cortex. So what's happening here is that these areas are getting downregulated. And what we also know is that with increased meditation experience, so the more someone meditates, the more there seems to be more of a decrease in this activity. So meditators have a lower pain sensitivity, and it seems to be correlated with a decreased connectivity between the executive areas involved in pain and pain processing and the executive and emotional areas. So what does this mean in sort of in other terms is that meditators seem to be able to feel the pain without thinking about and dreading the suffering which could be associated with it. And at the same time, the brain's ability, so that our brain has an innate ability to be able to dial down or dull pain. And when we bring meditation on board, it seems that our brain's natural ability seems to work better without the interference from the emotional windup that many pain sufferers have developed over the years, and getting back to the concept of a change and a shift in their nervous system. So that may be interesting from a sort of research point of view, but what's the clinical evidence? Do we have any evidence that mindfulness and bringing mindfulness in chronic pain management makes a difference in the lives of chronic pain sufferers? So this is one critical review of the literature from 2013 that looked at really the research from the 1960s to 2010. So there were 16 studies that were included in the review, 8 controlled and 8 not controlled. The majority of the studies, so 10 out of 16, indicated significantly decreased pain intensity. And out of the control trials, out of the 8 controlled trials, 6 out of the 8 indicated a higher reduction in pain intensity when compared with control groups for patients that were participating in a mindfulness-based intervention. Interestingly, and I think importantly, is that in follow-up assessments, the reductions in pain intensity were generally well maintained beyond the length of the program. Again, keeping in mind that many of the programs at that time were 8-week programs, so it was important to know if the gains were maintained. Meta-analysis from 2014, looking at meditation programs for psychological stress and well-being. So they included 41 randomized controlled trials, so close to 3,000 participants. And the conclusion was that there was moderate strength of evidence of improvement in anxiety, in depression, and pain. Now, is there any evidence for specific chronic pain conditions? So there's been some research done around fibromyalgia and mindfulness. So earlier research showing that there was a decrease in depressive symptoms in people who suffered from fibromyalgia who participate in mindfulness programs. And then a little bit later that year, research indicating that there was decreased pain scores, better pain coping, improvement in anxiety, depression, and somatic complaints, improvement in quality of life with benefits sustained for 3 years. Mindfulness-based stress reduction and low back pain. So an interesting article that was in JAMA of 2016, where they looked at the MBSR course, mindfulness-based stress reduction versus CBT or usual care. The highlight indicating that 60% of participants showed clinically significant improvement in back pain related functional limitation, which was similar to what they were getting in CBT. Keeping in mind, of course, that CBT was often done on an individual basis, and the MBSR, the mindfulness groups, were done with groups of patients, so similar results in terms of functional limitation reduction. Also similar results in terms of what they call pain bothersomeness, which is interesting because it's not a real word per se, but pain bothersomeness is actually very much correlated, or I wouldn't say correlated, but it is what patients who've gone through mindfulness programs will report. So kind of the idea that I talked about earlier, where they seem much less bothered by the pain condition, and it seems to have much less of an impact on their day-to-day activities. And again, improvements were maintained after 1 year. And it's based on this study and others that the mindfulness is now making its way into clinical guidelines. And for example, in the American College of Physicians guidelines in 2017 for low back pain, non-pharmacological treatments, including mindfulness-based stress reduction, are now recommended. So I just want to take a few minutes to speak to you about mindfulness-based chronic pain management, which is a specific program, which is a program that I work with when I work with groups of chronic pain sufferers. So it's a program developed by Dr. Jackie Gardner-Nix, physician and chronic pain consultant at St. Michael's Hospital in Toronto. So Dr. Gardner-Nix developed this program almost 20 years ago. And it was a program that was really based on MBSR, so the original program by Jon Kabat-Zinn, but that eventually developed into a different program that was more customized to the needs of people dealing with chronic pain. In particular, there is an attention to being trauma-informed and trauma-sensitive in the way the program is delivered and in the way mindfulness is delivered. And I'll speak to what that means in a couple minutes. And it's a program that's usually run with groups of patients, usually done over a format of once a week for 12 to 13 weeks. And the sessions last about 2.5 to 3 hours per session. And what do we do during these sessions? Well, there are many elements, parts to it. There's education and discussion around self-management skills. We look at factors that influence pain, always through the lens of mindfulness. There's an education around meditation and an ability and an opportunity to practice meditation during the sessions as well as outside of the sessions. And there's an element of group therapy as well. I just want to take a brief minute to talk to you about trauma and pain because it is important and probably an area that in my experience and in my understanding of pain has really evolved over the last few years. So we know that there is an overlap and that there is an increased correlation between having experienced trauma in our lives and developing pain. And we also recognize that many of our chronic pain sufferers that we see in the clinic have had sometimes challenging pasts, and that some people don't always heal after injury. And we know that this is true in different conditions, including fibromyalgia, arthritis, chronic low back pain, chronic headache, migraine, chronic pelvic pain, and this is not an exhaustive list. It's true in many other chronic pain conditions as well. We also know that there's an age factor. So when we're younger and we have an injury, we of course seem to be more likely able to heal. As we enter the later years, and in particular, if we've had perhaps trauma earlier on, our body has a more difficult time in healing, and then we're more likely to perhaps go on developing chronic pain and the suffering associated with the chronic pain. And you've got a few examples of books here, and it just gives you an idea of the recognition of how trauma affects the body. So here, when the body says no, the cost of hidden stress, the body remembers, and the body keeps the score. So again, and there are many others, but these indicate and underscore how people who work in the environments of trauma understand that trauma really has a significant and deep impact on our body. And you know, the theories and or our understanding of the relationship between trauma and chronic pain, we wonder if it has something to do with central sensitization, which I spoke about earlier, which we know is a facet of chronic pain. And with the idea is that is trauma having an effect on our nervous system so that we are more likely when we are confronted with a surgery or an injury or an illness to have a nervous system that's more likely to become centrally sensitized and develop chronic pain. So one of the hypotheses of how chronic pain and trauma may be related. Now, one thing that I want to mention is that I'm not suggesting that everyone who has chronic pain has necessarily had a history of trauma. Of course not. There are some people who have and some people who have not, but there is an observation that there is a higher incidence of trauma histories in some people who have chronic pain conditions. And that's where I mentioned earlier about the mindfulness-based chronic pain management program. One of the elements, there are many things that are different about it from the MBSR program and in the content of what's addressed, but one thing that's particularly important is that there's always an awareness of the program being trauma-informed and trauma-sensitive, and that pertains to the conversations that we have around pain and the content of the meditations that we bring and the way we work with meditation in the program. So back to the mindfulness-based chronic pain management program. It allows patients to develop insights into why pain and suffering have become established and help understand how physical, psychological, and emotional aspects of pain interact. It can help reduce reactivity and increase resilience. Of course, it's not meant to be a replacement for usual treatment. So, in my practice, for example, when I work with chronic pain sufferers, I'm still prescribing medications. I'm still referring patients for injections, for physiotherapy, for psychotherapy, for occupational therapy, for acupuncture, and all other aspects of chronic pain treatment, which is often multimodal. But what we do recognize is that patients who also have mindfulness and meditation as a tool in their overall treatment plan, it seems to make their other treatments actually become much more effective and useful in their overall well-being. And overall, we see an improvement in overall health, improved function, and decreased suffering. So I'll go very briefly over some of the outcomes that we've seen with the program: decreased perceived pain intensity, improved mental health, decreased pain catastrophizing, which is important, as many of you know, decreased measures of level of suffering, and decreased medication use for some. So although it's not an implicit goal in the program, we don't actually discuss trying to reduce medication, there are some people who come to this program or who through this program do find that they have a decreased need for some of their medication use. And you just have here a very quick snapshot of what that looks like. So the brown area, or the grayish brown area on the right, which is 34% of participants who have reported taking less medication after participating in the program. And what you had here was really medication specifically for pain. And we also see changes in other medications. So medications for anxiety, 26%, hypertension, 18%, depression, 17%, and insomnia, 30%. And what I would think is actually more importantly is we really see impacts on their well-being. So 73% of patients report being more productive, 60% report seeing their family and friends more often, and also increased engagement in favorite hobbies for 35%, recreational activities, 33%, physical activity, 40%, and volunteer activities. And the last thing I want to mention, and then we'll have some time for questions, is just about mindfulness and opioids. So I think it's, of course, an important topic when we talk about chronic pain management, and specifically with the opioid crisis, to have that in the back of our minds when we look at different approaches. So the question is what does mindfulness teach us, or what can it tell us about its usefulness in opioids? So there's an article that came out in JAMA Internal Medicine of this year in January 2020, looking at mind-body therapies for opioid-treated pain. And what they really want to know is, do mind-body therapies, generally speaking, help in opioid dose reduction and in helping patients with chronic pain? They looked at 60 reports with over 6,000 participants, with the conclusion being that overall, mindfulness or mind-body therapies were associated with pain reduction and reduced opioid dose. They looked over the different types of mind-body therapies, and there seemed to be moderate to large effect size improvements in pain outcomes for meditation, hypnosis, suggestion, and CBT, but not for the other mind-body therapies. Among the mind-body therapies, meditation-based interventions and CBT, so cognitive behavior therapy, were noted to perhaps increase patient self-efficacy, and that they involved developing self-management skills. And their conclusion was that insofar as mind-body therapies are associated with pain relief and opioid use reduction among patients prescribed opioids for a range of pain conditions, mind-body therapies may help alleviate the opioid crisis. Now, I'm of course not suggesting that mindfulness is the solution to the opioid crisis, which is very complex and has many factors involved, but it does seem to suggest that it might be one tool that we can have to help our patients manage chronic pain, and perhaps therefore have a role in the overall crisis. So in summary, what I hope to have been able to share with you today is that mindfulness can have numerous personal benefits in stress, anxiety, concentration, clinical applications in depression, and in chronic pain management. Specifically in chronic pain, that the suffering caused by chronic pain comes from the combination of the pain cessation and what it means to the sufferer. That pain is really a whole systems problem, and that with mindfulness, we can learn to uncouple the somatic sensations from thoughts and emotions. Being more mindful will allow us to have a shift in our pain experience, helps us to bring awareness to factors influencing pain beyond physical triggers, help reduce reactivity, increase resilience, and finally, with mindfulness, opening the road towards acceptance which allows a relationship with pain to begin to change and serve as a springboard to adaptation. I've put up a couple of resources here. The first one being the Mindspace Clinic, which is one of the clinics in Montreal. And there are others, of course, which offer different mindfulness programs, including the chronic pain one, the NeuroNova Center, which is the center in Toronto where the MBCPM program is really originated from, and some of the professional trainings that are available for people who are more interested to know more about MBCPM. So I'll stop my sharing here and would be very happy to take some questions now.
Okay, so thank you very much for this interesting presentation. We have a few questions that I'm going to read now. So the first one is, comment pouvons-nous devenir participants à votre programme?
OK, alors peut-être je vais répondre en français puis on fera la traduction après. Alors le programme, j'imagine que vous parlez du programme pour les patients parce qu'il y a aussi le programme pour faire la formation des professionnels qui sont intéressés à devenir instructeurs. Mais si on parle du programme pour les patients, pour l'instant, il est offert aux patients qui sont des patients de la clinique de la douleur au CHUM. Et il est offert aussi à la clinique Mindspace. Pour l'instant, c'est les deux places principales où j'offre le programme, mais j'ai beaucoup d'espoir et il y a des plans pour que le programme devienne plus disponible à travers le Québec dans un futur que j'espère sera pas trop loin. So what I briefly said is that the pain program for patients suffering from chronic pain in Quebec right now is offered through the pain clinic at the CHUM and through Mindspace. It's much more widely available in Ontario as well, and we're in the midst of hopefully expanding the program in Quebec as well.
Okay, there's another question about the program. Is this program free?
So yes, the program is free. It's as long as that's being offered by a physician. So in Ontario, there are physicians that offer the program. Sometimes the program is also offered by other healthcare professionals, including psychologists and psychotherapists. So when it's offered by a physician, it is covered under Medicare. Of course, it is not if it's offered through non-physician, although through some centers, and in particular in Ontario, it is part of some of the programs that are offered under their healthcare offerings in some of the centers.
Okay. And there is this question. J'aimerais savoir si vous traitez les douleurs neurologiques de type chauffage.
De type? Je n'ai pas compris.
Chauffage. So I guess thermal neuronic pain.
Alors, ce que je dirais, c'est que le programme, en fait, de gestion de la douleur basé sur la pleine conscience, il n'exclut pas aucun diagnostic ou type de douleur. Et puis, il y a des études ou il y a des observations qui ont été faites avec certaines conditions, mais lorsqu'on offre des programmes, c'est vraiment ouvert et peut avoir des effets bénéfiques, peu importe la condition de douleur de base. So what I basically said is that the mindfulness-based chronic pain management program, and I really, in essence, I think any mindfulness approach in chronic pain management is not particular to any one pain diagnosis and can include different types of pain, including neuropathic pain and burning type of pain, which is, I think, what the question was referring to.
Mm-hmm. Okay, thank you. There is another one en français. Si je comprends bien, la pleine conscience est réalisée sur la douleur et non pas pour détourner l'attention de l'endroit douloureux. Et plus cela est réalisé, plus la sensation de douleur est portée à diminuer.
Alors, c'est une très, très bonne question. Ce n'est pas nécessairement facile de répondre en 30 secondes, mais de façon globale, l'idée, c'est que et le principe, quand on commence avec un programme dans celui-ci, c'est d'apprendre à amener son attention sur des choses au début qui sont relativement neutres. Donc, au début, on ne parle même pas de douleur dans les premières semaines pour être capable de développer la capacité d'observer les choses avec une attitude qui est plus observatrice, avec moins de jugement. Éventuellement, lorsqu'on a cette capacité qui devient un peu plus connue, on peut ensuite amener notre attention vers des régions douloureuses. Et c'est tout à fait vrai que c'est très différent de la distraction. Donc, ce n'est pas une question de distraction, c'est vraiment une question éventuellement de développer la capacité d'amener son attention sur toutes les parties de nous, même les parties douloureuses, mais quand on le fait avec compassion et on le fait avec une nouvelle capacité plus observatrice et plus neutre.
Ok. Si on n'est pas de la région de Montréal, est-ce que vous pourriez suggérer d'autres programmes, et notamment des programmes en lien avec les acouphènes?
Pour ce qui est d'être en dehors de Montréal, il y a pour l'instant, il n'y a pas, en tout cas pour ce programme-là dont je vous parle spécifiquement, il n'y a pas de ressources, quoique avec la télémédecine, j'ai espoir qu'on va être capable bientôt de pouvoir l'offrir. Ceci étant dit, il y a des programmes généraux sûrement de pleine conscience, comme le programme de Mindfulness-Based Stress Reduction, gestion du stress de la pleine conscience. Ce programme-là est beaucoup plus disponible à travers la province. Ce n'est pas spécifique pour la douleur, quoique je pense qu'il y a des éléments qui peuvent être sûrement aidants et utiles. Pour ce qui est spécifiquement pour les acouphènes, à ma connaissance, je ne connais pas de programme spécifique qui adresse les acouphènes, mais encore là, je pense qu'un programme de gestion du stress basé sur la pleine conscience pourrait être peut-être un élément aidant même dans cette condition-là.
Très bien, puis je pense qu'on va peut-être en faire une ou deux et ensuite arrêter parce que le webinaire va être terminé. Maybe it's a choice of words, but focusing on the pain with compassion doesn't sound very scientific. Can you clarify?
That's a really good question. I wish we could have a live conversation because I would love to hear what is meant by scientific, although I could imagine, but I'm sure we all have our different interpretations. I presented you some of the science because I think it's important and because I recognize that I'm speaking to a group of scientists. Having said that, we know, and we've known for a long time that meditation has value, way before we had any capacity perhaps to scientifically study it. And one of the slides I showed you earlier actually was one of Mathieu Ricard, and Mathieu Ricard is a French Buddhist monk. But before becoming a Buddhist monk, he was a scientist who was, I believe, a molecular biologist who decided to become a Buddhist monk. But what was interesting is he came back to the West and to have people study his brain because he realized the value that it had and wanted to be able to help support this and present it to the scientific community. So that's where the whole idea of looking at EEG and functional MRI became important. And all to say is that there is certainly evidence of changes that are going on in the brain. And I don't think that we needed that brain imaging to demonstrate that it's been helpful, because we know it's been helpful, but it certainly allows us to have a better explanation of what is actually going on in the brain with mindfulness and with meditation.
Okay. And so this is going to be the last question. Au niveau de la formation pour les professionnels, comment ça se passe?
Alors, pour la formation pour les professionnels, c'est un programme qui est donné à travers l'Université de Toronto. Alors, je vous ai parlé du Neuro Nova Center ou bien de l'Université de Toronto. En fait, c'est un partenariat entre les deux et c'est une formation qui se donne. Nous sommes une équipe de 3 ou 4 formateurs et il y a plusieurs morceaux pour la formation. Mais si vous regardez sur le site web, ça vous donne toutes les indications et comment ça se donne. Ce qui est intéressant, c'est qu'avant, ça se donnait seulement sur place à Toronto. Maintenant, depuis qu'on a viré vers le Zoom, toutes les formations sont maintenant données par Internet.
Ok, très bien. Well, thank you very, very much. And so as I said in the beginning of the presentation, this webinar are being recorded, and the recording will be shared to all the person that registered to the event. I hope you enjoyed as much as I enjoyed, and that I wish you a lot of success. Thank you very much.
Thank you. It was a pleasure, and thank you for your interest. Okay. Bonne journée à tous.
Bonne journée. Au revoir.